and welcome to Roundtable. I'm your host, Adam Cook. This week, I'll welcome Nova Scotia's Minister for Mental Health and Addictions, Brian Comer, to the program. And he's going to speak to us about a new virtual care option his department recently unveiled. For our segment, The Front Porch, I'll talk to a young Ukrainian journalist who is finding healing from the war in Ukraine through her work in local journalism right here in Canada. But we begin with selected highlights from a community consultation that was held just last week at the Port Hawkesbury Civic Centre. It involved Nova Scotia's Minister for Health and Wellness, Michelle Thompson, several members of the department and of the Nova Scotia Health Authority, as well as local MLAs Alan McMaster and Trevor Boudreau. The group is traveling from various communities all the way around Nova Scotia to try to get a better sense on the needs of individual regions when it comes to frontline health care. So you're going to hear from a number of different people over the course of the next half hour, which was provided to us by the Nova Scotia Department of Health and Wellness free of charge. Here to kick things off is one of the public participants in the evening. His name is Michael Hatt. He's the owner and operator of the Medicine Shop Port Hawkesbury on Reeve Street. Here's how his part of the conversation on local health care began.
I'd like to take two opportunities before I get to my question. Thank you for giving us a forum to ask questions. And two, I want to acknowledge the fact that our healthcare crisis was not brought on by this government, but of course previous Conservative, NDP, Liberal governments of the past that didn't acknowledge that this was coming. My question is kind of a follow-up to your reply about pharmacists and other allied health and their expanded scope. And it's also about how you prioritize need for areas such as the Strait area. And the reason I bring this up is I recently applied for a pilot project for our pharmacy because the Strait area was identified as a high need area. But by the time that the allocation for those pilots was done, the Strait area was no longer identified as a high need area. And I'm wondering if you could elaborate on how those high need areas are distinguished, if it's just by the 811 list, because I can tell you firsthand, waiting on a lot of our patients, is very few of them are actually on the 811 list. We do have a more senior population, more spread out population here, and rural internet is also an issue with our clients, so things like virtual care don't work. Love to have them come to the pharmacy and do a virtual care, just FYI. Yeah, if you could just elaborate on how those are picked, that would be great. Thank you.
I do want to talk about virtual care, and then I would like Minister McMaster to please discuss the internet. So you mentioned internet and virtual care, and frankly, folks, virtual care as it exists today, it's good. It's going to be better, and all things virtual are a path to the future. It's not going away. It is going to expand, and it's going to be very important for people to be able to access, to be able to understand how it works. There will be a day coming very soon where you will have a lot of what we're talking about here on your phone in an app in your hand, okay? So internet and cell service become very, very important components to healthcare. So maybe, Minister, if you could just talk about your plans for this area and for the province, that would be a good starting point. And then I'm going to come back to the question.
Well, I think we all know how important high-speed internet is. And I know people who live right in town here, probably not as much of an issue. I think you probably have pretty good internet, but many people around all over the province suffer with poor internet. So the short answer is, by the end of 2023, contract signed in this area with Bell should bring fiber to the home for everybody. And fiber is future-proof because you're using, I won't get into too much of the technical aspects of it, but you're shooting light through cable. And they've discovered you can now actually shoot colors of light, so it's vastly expanded what was already an excellent way to communicate, and it's future-proof. That's what they say. For people, and you can follow this on the internet. So by the end of 2023, just about everybody should be connected fiber to the home. You can check on, there's a website, we can share it with you at some point. You can follow community by community to get an update on when your community will be connected. Beyond that, there are still going to be people who can't get fiber to the home. So the government has subsidized low Earth orbit satellites. It's a shorter distance up and down, and the end result is there's less delay, and it's very good. I know somebody in Craignish who has it, and they rave about it. They get really fast speeds with it. So by the end of 2023, most people in the province should have really good high-speed internet, and if the future is as you say, on your phone, well, then you should have good connectivity coming soon. I want to say something about cell phone coverage. This is kind of something that I always plug, and it's not the official word, but I'm going to say it anyway. We don't have great cell phone coverage, and it becomes a safety issue for people. It becomes, I would say, a recruitment issue. Who wants to come from an area from another part of the country here and suddenly want to buy a home and you don't have cell phone coverage? You know, your kids are complaining, and so on and so on. That is something that I don't think we can rely on the private sector to deliver. If we could, they would have delivered it long ago. There's no money in it for them. The province owns many towers. We've got over 80 towers, I know, at least around the province, because we have communications needs too. Why don't we buy more towers? We could capitalize the cost. It might not even cost us anything at the end of the day. We could lease space in the towers that we put up to all the private sector cell phone carriers. Competition, better prices, better service, and we solve the problem of poor cell coverage. So I think that's the way to do it. That's just my thought. And I hope that we do that as well, because if people are using cell phones, you know, and if they're mobile, they might need to access their health care on the road or wherever they happen to be. So I'm hopeful, because I think that is very critical for everything, healthcare, and for people working from home, and for living our everyday lives, because we're in the world now where we need to be connected.
The pilot project through the Pharmacy Association of Nova Scotia. Okay, I'll chat with you after, and I'll get you a more fulsome answer, because I know the department has been working with them on certain aspects of it, but I'm not exactly sure who determined the criteria. So I'll connect with you offline after and make sure you get a fulsome answer.
So I guess the question, though, is your resources, not just pharmacy, doctor, nurses, the travel clinic. You know, how would we prioritize the straight area? For example, Antigonish just recently in September lost a lot of doctors due to retirement. 25-30% of our clients saw those doctors. Does that get factored into the straight area? Yes. Or is that an Antigonish area? You know, we're looking at the straight area, maybe a Port Hawkesbury at 3,500. If you scope Richmond County down Route 19, we're talking maybe 25,000 people. Most of whom aren't on 811. So how do we prioritize the need?
You know, physicians, the majority of them are private folks, and so we don't always know when we have a physician that's going to retire. But when we do know, we work with them to the best of our ability to plan, and we plan based on their panel size. So it may not capture specifically, especially if they're still on a paper chart. I'm thinking about the practice that you're talking about, and so they're still on a paper chart. So it's really difficult for us to attach people to postal codes, as an example. But what we would look at is the panel size that they have, and we can understand that through their billings, and physician services have lots of different ways to understand that. So it would be looking at that. So it would be a little bit harder, which speaks to the need for the technology, right? Making sure that we have more integrated services so that we can look at postal codes, so that we can look at health equity, making sure that people have it. So there is some health equity work that's happening now in the department and with Nova Scotia Health around a health equity framework, race-based data collection, all of these different things. So there is work happening, but we need better connectivity around that. But we do plan based on retirements when we know, based on the panel.
We have a lot of data. a lot of data, and we are able to, rack and stack to really get the answers to a lot of the questions that are asked. So, for example, I can have data analyzed to see how many Nova Scotians are either on the Need a Family Practice list or, to see where the greatest needs are. And typically when it comes to recruiting, the areas where we have the greatest need will be pretty high on the list, okay? That doesn't mean we're always successful, because as Dawn said, if a person comes and they decide they want to go to Kentville, we're not going to say no. But we are also extremely mindful of where the biggest pockets of need are. So I would say need is high on the list. And I might just take a minute to talk about the list. It hasn't been a question here, but it certainly has across the province. And so what I like to just talk about is the virtual care, and then I'm going to ask Janine to maybe talk about what we're doing with the list. So if a Nova Scotian is on our Need a Family Practice list today, then you are eligible automatically for Virtual Care Nova Scotia. But you have to sign up for it. And we have folks here, I think, tonight that could actually help with that. So you're eligible to be on the VCNS, and you just sign up for it. What that enables you to do is to be seen virtually, and that would either be by a physician or a nurse practitioner. And that person, and it works quite well, like there's not a long wait time. You can't do everything virtually, of course, but you need a prescription renewed or something very basic. It works like a charm. Now, the care provider may refer you to a specialist. They can do that through VCNS. Or maybe you need to be seen in person. And if that's the case, you would be referred to one of our clinics. And again, they work quite quickly. In fact, it works sometimes better than trying to get an appointment with your own doctor, which is presenting another problem for us. So then everybody wants virtual care in Nova Scotia because it does work so well for certain things. And so at the moment, it's only available for those on the list, but we have heard enough feedback now that the next step will be to make that available to all Nova Scotians, but it will take time to build it out. It's kind of a massive undertaking, but that is our plan, to make that available to all Nova Scotians. So you've heard lots about the list. We certainly hear lots about the list. So Janine, can you maybe just inform folks where we plan to go with the list?
Sure. So we do hear a lot about the list. I'm sure some of you here in the room this evening are on the list. We know there's approximately 100,000 people right now that are on the Need a Family Practice list. The issue that we have with it right now is that it's static, that really someone's name goes on, but there isn't an appropriate triage of the person who's going on to the list, that we don't know kind of if you have multiple health conditions, or if you're a relatively healthy young person, or what your situation is when you're on the list, if you're pregnant. So what we're working to do is making the list more interactive for both you as the citizen and for us in matching you with a provider. So I'd say kind of stay tuned into the new year, but that we are working diligently to make the list a better tool, especially for you, but also for us to be able to help you to get the care that you need, and to be able to see who really is of highest priority, that it might not be a first come, first on, first off, but that we have the information to allow us to make more informed decisions about that.
So this is specifically around internationally educated physicians. So physicians from abroad. There are massive obstacles for foreign doctors to receive a license to practice. They have to redo their exams like a student, and the question is why? A lot of foreign doctors are experienced and come from a comparable health system. Is it not better to have is it better to have no doctor than have a foreign one filling the vacancies?
This is the bane of my existence in the sense that I would just, if I could wave the wand, come in, here's your job, let's get on with it. Unfortunately, it doesn't work quite that easily. So we have colleges that we need to deal with. Where I go off the rails here, Don, you can put me back on the straight and narrow, but we have our provincial College of Physicians and Surgeons, and we also have our National Royal College. And similarly for nurses, similarly for other professions, pharmacy and so forth. So the colleges are very, strict around practice requirements and so on and so forth. So let's just focus on doctors for a second. We do have a lot of internationally educated physicians that are either that their families have come to Nova Scotia, they've arrived in Nova Scotia, and they have had the dickens of a time trying to get through the process. The Royal College is working with the federal government of Canada to streamline that process, and in turn, provincial colleges are looking for ways to streamline that. So I'll get this wrong, but our college recently relaxed a requirement for a physician to have to take an exam after, I think they've been here for 5 years. And they may be here on a defined license or some kind of a restricted license, but they can stay without having to take that exam. That's actually a big move for our college, and it puts us in a unique spot, kind of a competitive spot right now to be out and recruiting docs outside of Nova Scotia. So that's a help. I know that our 4 Atlantic provinces are also the colleges of all 4 Atlantic provinces are looking for ways to streamline amongst our provinces. That's being led by the premiers, so that there can be easier mobility and certification as between the 4, which I think is a positive step. So there's a lot more work that has to get done. Our college, our provincial college, has also worked very closely with us to put a couple of new streams in play. So we have a new stream called a clinical associate. Do I have that right? Which, is a more restricted way of practicing, but nonetheless, it opens a door. Okay, so for example, there were a number of Ukrainian physicians who landed in Nova Scotia, and we were able to find spots for them through that kind of a pathway, which was good.
So we're also looking at competency-based assessments, so practice-ready assessment, so that we look not only at the bookwork, at the degree or at the credentials, but when people come and want to work in Nova Scotia, we pair them with physicians, so that those physicians can assess their competencies. And one of the things I think that the Ukrainian nationals have taught us, when you don't have records, like most of them have records because of they've had to leave a country unexpectedly, or maybe their records are destroyed. How then do we work with clinicians to look at the competencies that they have and the skills that they have? So it's challenged us to kind of look at how we do that. So I think it's been positive in that way. And so I think we continue to look at ways to bring internationally educated graduates here. The other thing is we have a number of Nova Scotians who are internationally educated graduates. They go to Britain, they go to Saba down in the Caribbean, Australia to train, and the issue now is that they have difficulty getting a residency, which is imperative that they have that residency when they come back. So we were able to meet with the Canadian residency matching service, and we're looking now at the next stream and how we're able to identify Nova Scotians who trained abroad in order to bring them back and make sure that they can work in their home province. So there is a number of things that we're doing to address that.
And here's the really good news, which is this year in July, Dalhousie Faculty of Medicine will graduate the single largest group of family practice physicians in the history of Dalhousie University. Okay? So we are working hard with them to open those doors in every way possible. So, next question, Nancy, please.
Another submitted question. Back to virtual care. I would like to ask how virtual care can be made more user-friendly. As a person who works on a computer 7 hours a day, you have to be prepared to upload documents, type your issue in, lost contact with the doctor, and hard to get contact back. If I found it difficult, how are seniors supposed to navigate the system?
Okay, great feedback. I think that came here. So, yeah.
Excellent.
So, this is the kind of feedback that we need. So with respect to seniors, I would just share the following. Number one, not all seniors have a computer. Number two, not all seniors know how to use their computer. And number three, they don't know how to do all that kind of stuff. Like it's not easy, as you say. So this I would just share with the community because I'm just looking at this fantastic building, which I've never been in before actually, seen from the road only. What they did with the Aberdeen Hospital Foundation is they paired with their local library, and the foundation paid, and they set up a kiosk type deal in the library and had a person that can help seniors. Sign them up for virtual care, get them hooked up, get them sorted, work them through it, and it's working like a charm. Did the same thing in Bear River and doing the same thing in Yarmouth. And these were all just community groups, but two were hospital foundations. So that might be something to be thought about by some community group, and I bet you this building's pretty well used, so it's a possibility. The other thing, there are folks here from virtual care, and there are folks back at the ranch who can help anybody get sorted. So for example, I had an example 2 weeks ago. A woman in the valley, she had a physician, but her children, 4 of them, lost their physician, different docs. And the children were all under the age of 16. And so we had the dickens of a time trying to get each of the children onto the registry. We did it. So it's finicky. There's some finicky little bits, but there's help, and there's people who will guide you through every step of the way. So I think what I would just say is, definitely don't give up. I would encourage MLAs to make sure that somebody in their office knows exactly who to call and how to do it, because I'm sure you'll get the calls, and you should.
I think the other thing that we haven't said here tonight either is that on not this one in particular, but on a number of the initiatives that we're working on, people are working at the speed of light, I think is the fast way to say it. So we aren't always getting it right the first time. So we really need feedback like that, because if the more people start using it, and it might be intuitive or to get something going, to get people something as quickly as we can, but then we need to hear when it isn't working or when we could change something, because that's the part of the test and try. It's us getting it out to you as quickly as possible, but we don't always get it right. Like, we know that, and so we need to hear that back from you, as Karen said, to us through your MLAs and that, but just please, like, we are really looking for that kind of feedback, so thank you for raising that.
My name is Paul Shears, and I'm with the West Bay Road and District Volunteer Fire Department. Also represent Straight Area Mutual Aid that has 28 fire department members. Departments, I should say. I want to go back to ambulance response times. I believe EMC has a requirement in rural areas to meet a certain criteria for a response time. I could be mistaken, but based on the number of calls in the past year, with a number of the fire departments in the Straight Area Mutual Aid, it's become very clear to us they're not meeting their standards that have been set by the government. Reasons are twofold, obviously. There's not enough paramedics manning ambulances, we get that. Straight Richmond Hospital being closed is another big issue for us. That means the ambulances that we have stationed in Arishat, St. Peter's, Port Hawkesbury are either gone to Antigonish or they're gone to Sydney. This is creating huge wait times as MFR departments are dispatched out on medical calls, trying to deal with patients and explain to them the system and the reason for their wait. And I can allude to Blair's statement earlier because we were on a medical call that evening when that accident occurred in Petit de Gras, and the ambulance that was coming to our medical call was turned around and rerouted to Petit de Gras. And we had to wait another 40 minutes for another ambulance. That being the case, those ambulances that were dispatched that night came from Antigonish. We had none in our area. Also the fact that when this happens, they are rerouting ambulances within the whole area. We've had a number of calls now where we've waited for an ambulance to come from Marguerite, Quebec, Inverness. There's been medical calls out in Lordways and St. Peter's where ambulances have come from that distance as well. So I guess my question is, how does the government make EMC accountable to meet these targets? There's no issues with the volunteer fire service responding to medical calls. Let's make that clear. Every volunteer fire department that's out there that's responding to medical calls do so for the public they serve. Okay, so I want to be perfectly clear on that. We also do not get paid, we're volunteers. In order to become an MFR, the volunteer fire department has to cough up over $450 for a member to take the MFR course. EMC is paid for what they do. I don't quite get the fact that EMC should not be covering off the fees required for volunteers to become MFRs. After all, we're stepping up and holding the fort until paramedics arrive. That's a pretty big cost burden to volunteer fire departments, and people have to realize that. So I was talking to Jeff earlier because we had a short session outside there where we discussed a few things. The government's plan with the CCAs was excellent, okay, covering their training costs, excellent. And we were talking about maybe the same thing could happen to paramedics. Okay, why not the same thing happen to nurses? That's thinking out of the box, and maybe that's something that the government needs to actually look at. So, just in summing up, I don't even know what the question was now, but...
Well, your question was, how do we make EMC accountable? And your suggestions were that we look at doing something for nurses and paramedics similar to CCAs.
So,
I think that's what you were
yeah,
saying.
I think so.
And the cost of MFR training.
Which I kind of like.
I haven't been in MLA very long, but I've learned a lot from those two chaps over there, I have to say. I've met with them a few times with my colleagues, and I'm grateful. Helps me understand our system better every time we meet. And so we're really grateful for the work that you do in your community and your dedication, because I know you give hours and hours and hours. And so I really do want to acknowledge you and your colleagues for all the work that you do. So we've met on a couple of occasions, and I know that perhaps, Jeff, there may be some things that you want to talk about in terms of what the work that we're doing. And I know that I think is it February that we're going to come and meet with you and Straight Area Mutual Aid to talk about the role of the MFR and to see how we can better support you in terms of your delivery of service and the way that you respond. So I think there's a lot more to say, but maybe, Jeff, there's some things you want to talk about that we've on the accountability side.
My function as the regulator, the executive director for emergency health services, and EMC is our partner in service delivery. we certainly have some challenges. There are things that are out of EMC's hands at the moment. So one of the challenges we have when we take patients to hospitals and we get wrapped up at hospitals for longer than the standard of 20 or 30 minutes to flip to get the patient into the emergency department, those impact what EMC's scope is. And so that impacts our response times across the board. It's not something they can control, but what we can control are, as I mentioned earlier, are the patients that we do take to those emergency departments with some of these novel programs that we're going to put in place. Now, Paul, you know I believe this, but I'll say it for everybody's benefit. We really appreciate the work that the medical first responders do across all of our communities in the province. And I think our hallway session tonight, we had my colleague and friend here, Kevin from the union. First thing he said, he's still an active paramedic. Nothing makes him happier when he arrives on scene and he sees a fire truck and the guys are there and the team's there ready to help out. So we value what you do, but much like much of our system, we have to modernize it a bit. And we really have to look at what we're asking you to do. And so that is a review that's happening now. So we've well undertaken it. And it began after the meeting we had with you folks. And I went on to meet with the Fire Service Association of Nova Scotia to have a better understanding of the challenges that the fire services have and the way that they support the EHS programs. So much like what I had said earlier, status quo is just not an option for anything. So everything is on the table for us to look at. My job and my team's job is to hold EMC accountable for the operating of the service. We've added a few resources to help us do that. We've got a brand new director of regulation policy. We need to have good, solid policies to make sure that our system functions the way that it should. But like any rebuild, it's going to take some time. So we will continue to do the things we're doing to try to increase the capacity, take the strain off of our MFR partners. And we do recognize that these are volunteers, heart and soulers in their community, and we do have a lot of respect for what they do. But I do want anybody that's in here as an MFR to know that we do hear you, and we are looking at all kinds of options to try to make the changes in place that better support all of our communities.
We're going to ask you for your patience, Paul. But that we keep the dialogue open. How would that be? And you know how to get us if you need us. Like, we want to be good partners to you. Yep. We know where you're at. I know you know. I rue the day these two fellas introduced. No, I'm just joking.
I want to thank everyone for taking their time, and I'd like to actually call on your MLA for Richmond, Trevor Boudreau, who's going to say a couple words before we close up.
Thank you, and thank you for everybody for attending. But you know, last year this senior health team traveled the province and visited with healthcare workers and listened. We've heard that. We all know that. And the second time around, they're coming around and listening to communities. And I would say that's the first and second time that a health leadership team has traveled the province. Maybe I'm wrong, but I think that's the first time in history and the second time in history. So I'd really like to extend our appreciation both as MLAs but as communities that you really do care and you want to hear what people have to say and you want to understand so that we can make a difference. And it's been said here tonight, I'm a healthcare worker. My wife, Karen, has showed up, so you actually might get to meet Sarah, who you were talking about earlier. But you know, we have felt this for a long time, and there's 5 MLAs in our caucus that are all healthcare workers, and I would tell you we all ran for very similar purposes. We very value our healthcare system. We've seen it in crisis. We've known it's been in crisis, and we want to make a difference. And so I would say we have probably the most qualified health minister in this country. And I'm not saying that, but we know what we have, and I'm very appreciative to the time that they put in and that she puts in, and certainly how she dialogues with me. So I really do appreciate that. I would like to take the time to extend a thank you to the staff that's here. So we have staff from the Nova Scotia Health and from the Department of Health and Wellness. And like we said, and it's been said here, they used to work in silos, but now they're all here together. And I would really like to thank the staff for coming out and traveling across the province and putting that time in. And I certainly want to thank everybody here. These are challenging times, and you're asking very good questions, and people have a right and a reason to be worried and concerned. But I want you to know that you have a team that really does care, and they really want to put the effort in. And I can tell you that I'm very impressed, and I am grateful for what they do. But thank you for all coming, and I think I'll close by just saying, keep the dialogue going. So you have MLAs here that 3 of your local MLAs that you can reach out to, and certainly we want to be there for you.
And once again, we'd like to remind our viewers that the footage from the community consultation on healthcare that took place on December 2nd at the Port Hawkesbury Civic Centre was provided to Telile free of charge by the Nova Scotia Department of Health and Wellness. And you can see more footage in a special edition of our sister program, Telile 24/7, this week. But now we'll shift to mental health, which is also an integral part of frontline healthcare here in Nova Scotia. A new program that's been introduced by Nova Scotia's Department of Mental Health and Addictions is hoped to ease the logjam that's often found in terms of people trying to get mental health assistance and psychiatric care. But it's also designed to be able to get people that care more quickly through virtual options, including regular coaching and counseling. So what is this Tranquility program all about? Here to explain is Nova Scotia's Minister for Mental Health and Addictions and the MLA for Cape Breton East, Brian Comer. This week, your government announced a partnership in terms of virtual care for mental health. And this is something that's going to give people an option to have some counseling done virtually. And it's in partnership with a group called Tranquility. The program is made right here in Nova Scotia. Can you tell us a little bit about what the program offers and why your department and your government felt it was a good idea to partner with them?
So the program offers ICBT, so internet-based cognitive behavioral therapy, so primarily used for mild to moderate anxiety and depression. So Joel Muse was one of the co-founders. A pretty incredible story. Started off his career as a stockbroker, had some mental health issues himself, and decided to actually improve the system. It led to a partnership with Dr. Penser, a clinical psychologist here, also from Nova Scotia, which ultimately led to the development of this resource, which is now free for all Nova Scotians.
So how can people get this kind of service, this kind of virtual care? Do they need a referral from a physician? Is it something they can access right away? What can you tell us about the process of getting this kind of care through the Tranquility program?
Yeah, so it's self-referral. So tranquility.app/Nova Scotia. Also, if you just do a quick Google search, Nova Scotia Tranquility Health, it'll take you right to the page. There's a brief intake or initial assessment to ensure that you're appropriate for the service, right? So like I said earlier, it's for the mild to moderate. So prior to yesterday, you would have had to get a consult from a primary healthcare provider. So this makes the access, much more easier, for Nova Scotians.
Taking a look at the details of this, Minister Comer, it seems that the Tranquility program is set up to be able to offer those struggling with mild to moderate symptoms of anxiety or depression with a half-hour coaching and counseling session from those involved with Tranquility. That can happen on a weekly basis. How long is that program designed to run for each individual person? Does it cut off after a certain period of time? How does that happen?
Yeah, I think the program is 26 weeks, I believe. So it's a pretty extensive program, actually. So that's and the ICBT or CBT, if it's in person, is a pretty well-known, effective modality of treatment, I would say, for mild depression and anxiety. So it's also a very, I would say, user-friendly application. So if you just go on the website, it's very straightforward. I would say I was on it myself a couple different times. So I would encourage folks that think that they need it, or if loved ones need it, to use the service.
I don't have to tell you, Minister Comer, about the difficulties that the mental health sector has experienced in recent years, and we have heard the horror stories of people trying to get services, waiting in basic ERs for hours and being turned away or not getting to see anybody at all. Are you hopeful that partnerships like this with the Tranquility program will help to lessen that kind of backlog and be able to give people the immediate care that they need before things worsen?
Yeah, I think if you look at, the addictions and mental health care for individuals, right, it really varies in intensity and levels of acuity. So I think if you look at the peer support line, for low acuity, mild to moderate, to this service is, mild to moderate also. I mean, if you can help individuals kind of get that help when they need it at that point in time, it hopefully can resolve the situation before it kind of develops into a crisis situation, which typically gets people to emergency rooms and can often lead to inpatient psychiatric admissions to get them feeling better.
The flip side of that, of course, Minister Comer, is that this could wind up loosening up the logjam that often happens in terms of being able to get mental health patients that kind of care. Are you optimistic that by giving people another option like this to be able to receive some virtual care, coaching and counseling, that it will lessen the wait times for those trying to get that psychiatric care that they need?
Yeah, I think if you look at the different initiatives that we've already announced and what we're working towards, if it's, a day hospital in Halifax, I recently announced a day hospital opening in Cape Breton, very promising metrics thus far with those evaluations and their impacts on, the inpatient system and ERs and these sorts of things. So I think it's a valuable tool, right? It's very accessible, especially for folks living in rural parts of the province, such as where you're talking to me from today. If you can just really, have that accessibility, I think that's also a very important aspect of the service.
You mentioned the day hospital that's been set up at the Cape Breton Regional Hospital in Sydney. Obviously, we're just in the early days of that, but do you and your department have a sense on how that seems to be working at this stage?
Yeah, so implementation is tentative for the spring, so it's not up and operational yet. So
Okay.
Plans are very active, I would say, and underway. We did have some successful recruitment of a couple psychiatrists from the UK coming. One of whom is going to be an important piece to delivering service with the day hospital, actually. So things are well underway, and the spring won't take long coming, right? So we'll be working hard to get that up and going.
December, often painted as a happy and jolly and joyous time, is not so for many that struggle with mental health and with depression. There can be many reasons for this, but I just wonder, could we get some thoughts from you about the idea that we need to be looking out for those around us who could be struggling at this time of year?
Yeah, that's a good point. I mean, whether it's some people it's the first holiday where they, may have lost a loved one, right? Since the previous holiday can be a very difficult, time of year. You got to be very careful with your substance use, I think, too, right? Lots of, alcohol and those sorts of things available during the holidays. I think most importantly, just check in on your loved ones, right? Check in on your neighbors, your family. It's very important that people check in on one another, and we know it's a pretty difficult couple of years, right? It's been a bit of a grind, I would say, for many Nova Scotians. So I think it's important to take that time and just check in on people. And if they ever need help, make sure you reach out to get the help. We're certainly here to provide that help, especially if it's ever, a crisis situation. Please reach out for help.
All right, as we're winding down here, Minister Comer, as I mentioned, not only is Christmas coming, New Year's is coming as well. You mentioned the implementation of the mental health day hospital for the Cape Breton Regional Hospital up in Sydney. Obviously, there have been a couple of projects that have just gotten underway as pilot projects in terms of care being offered at the Cape Breton Regional, but also St. Martha's Regional Hospital in Antigonish. Are there any items on your New Year's wish list or on the department's New Year's wish list that you're looking to get going as 2022 turns into 2023?
Yeah, well, I think we'll be working hard to get the day hospitals. We're going to continue to work hard to get the recovery support centers, right, set up across the province. And then before you know, we'll be coming into the spring budget, which is will be a very important time of year for myself as we kind of continue to strive towards universal access, right, to addictions and mental health care. So that's certainly the most significant focus of my mandate. And I continue to work very hard with my department and with Nova Scotians, I would say, to kind of keep working at that.
All right, we've covered a lot of ground in a short time, Minister, as I thought we might. Did you want to add anything else about all this just before we wrap up?
No, just thanks a lot, Adam, and have a great holidays.
All the very best to you and your family as well, sir. Thank you again for joining us today. Brian Comer is the Minister of Mental Health and Addictions for Nova Scotia. He is also the PC MLA for Cape Breton East. Some of you may be aware that Telile Community Television is a member of the Canadian Association of Community Television Users and Stations, or CACTUS for short. CACTUS has a program called the Local Journalism Initiative, which allows people like myself and my French language counterpart here at Telile, Gabrielle Sampson, to provide news coverage for Telile viewers. Well, the same program has recently started welcoming Ukrainian journalists, and my next guest is going to share her unique story of going quickly from the journalism program in Kyiv to starting a new life in Winnipeg at U Multicultural Channel once the Russian invasion of Ukraine made it unlivable for her in her home country. Let's meet Yullia Kovalenko right now. Yullia, thank you very much for joining me on the Front Porch today.
Thank you for having me, Adam.
It's a pleasure to have you join us and to share your personal experience. The first thing I wanted to ask you is, can you describe your home to us? You are from Ukraine. What part of Ukraine are you from? And can you describe the place where you grew up and the place you lived before you came to Canada?
Okay, so I was born and raised in a small but pretty quiet town called Pavlograd. It is located central east Ukraine.
Okay.
So the population, like 100,000 people, there were not so many things to do. We just had a small restaurant, park, school, that's it. But over the last 5-6 years, our town was transformed, really, and the town has developed construction. There are new roads. There are lots of new place area for children. So it makes me really proud of my town and my city. And I still have lots of warm memory about my childhood and about the time I spent there. But the last 2 years before the war, I lived in Kyiv, as the capital of Ukraine.
How did you decide that you wanted to be involved in television and in journalism?
So I started to be interested in video in 2016 when me and my friend started a YouTube channel. Yeah, it was her idea, not mine. And I was worried the first time, but once I sat down in front of the camera, I realized that I want to connect my life with video production. I did all stuff myself, like editing, shooting. I have no lots of money to buy a professional camera or good like lighting. It was not professional, but I really enjoyed it. So I continued to do that. Then I started my own YouTube channel, and I understand that I really enjoy it. I can spend hours of editing. I can spend hours of filming myself. I love talk to my camera. And then I started to get positive comments from my followers and from my family, from my friends. People told me that I did well. So I really enjoy it. And then I decided to get into a Kyiv National University of Culture and Art to get a journalism degree. Okay. It is one of the best university in Ukraine, and I'm really proud that I studied there. I'm still a student. I'm still a third-year student. Yeah.
Has the university allowed you to continue your studies remotely while you were over here? Is that how it works?
Yeah, I study remotely. I pass my exam. Everything is remotely. Yeah, so I can continue to study.
What do you think one of your favorite things was that you did working on this YouTube channel with your friend?
My favorite things? It's just atmosphere, you know. You sit down, we just have fun together, and at the same time, people who are watching you, they like it. They write me a message that thank you, you are inspire us. Thank you for doing your job. It's so interesting to look at you. And okay, it's really what I love. This feedback from people, I very appreciate when somebody write me this comment. It's very inspiring.
Do you feel that what you've learned in terms of video production and interviewing from your work on YouTube and also from your journalism training in Kyiv is working for you as you do your job in Winnipeg? Do those skills help you to this day?
Yes, of course. I learned a lot in my university, and when I applied to my job here in Canada, my manager asked me to send my portfolio, but I didn't work in Ukrainian channel, so I just sent my work that I did for my university task. Yeah, and when I came to Canada, I was ready. I had my own camera, I had my own laptop. I know how to write an article, how to make questions. And I also learned how to communicate with people, how to edit videos. So when I came to Canada, I think I was ready just to start to work, and I'm really very grateful to my manager because I got a job since my first day in Canada, and I do the job I really enjoy. So, and it's very, very helpful.
So obviously a major reason that you are where you are right now is because of the conflict that's been going on in your home country for the past 9 months. You said you were living in Kyiv at the time, and of course Kyiv was one of the hardest hit parts of Ukraine when Russia started to invade. What were those early days like for you when you realized that this is what was happening?
It was the worst day in my life, really. I was at like I was living with my friend, and when the war started, I was scary. I didn't know what to do. I thought that I have no future, and I really lost myself. And when I heard the first siren, I faced a depression at first time in my life because I thought that I have no future. Where should I go? What should I do?
Were you in contact with your family at that time? What were they going through?
Just we phoned to each other, and they were scared as well. Yeah. So, and then after a week, I moved to Poland with my friend. And when I found out that Canada opened a new program for Ukrainians, I immediately replied. I thought that this is a great opportunity for me to start a new life and to build my life from scratch, because I work hard in Ukraine, in Kyiv, to build a successful life, a successful career. But at the moment, just like all my life fall, and yeah.
You made a very big decision more easily than a lot of us here in Canada make very small decisions.
I just thought that Canada, it's a good way to start a new life. Just all what I did in Ukraine doesn't matter anymore. So I have to move, I have to work hard. And when I came to Canada, I was not ready for immigration. I didn't know anything about this country, really. And I came with the poor English. I came with the small suitcase. I had only hand luggage. That's all what I have. Yeah, but I had a big desire to build a successful life, and in myself as well.
Did you know that there were Ukrainians living in Canada or people of Ukrainian descent? Had you heard anything about that? Because you wound up in Winnipeg, which has a large Ukrainian community. Did you know any of these things before you came over?
I knew that there are a big Ukrainian community and they are ready to support newcomers. So yeah, it's very easy to integrate into Canadian life, into a new society when there are lots of Ukrainians and they are in the same situation like you and they want to support you, they want to help you.
What was your first impression of Winnipeg when you finally got here and settled here? What did you think of the city?
It is nice city and I love people who are living here. They are very nice, very warm. Everyone try to help you. Everyone try to understand you, even if you make a lot of mistakes in English. They don't judge you. They try to communicate with you. They always ask me, how are you feeling? So yeah, I met some Canadians here and they are my friends now, and they always text me, how are you feeling? And I very appreciate these people.
I am curious about whether language has been an issue for you within your journalism work. It sounds like people have been receptive to the idea that English is a new language for you. How's that been working out in terms of what you've been doing in Winnipeg?
Oh yeah, English issue is a big problem for me. And when I was in Ukraine, I thought that my English is a high level, but when I came here, I realized no. First time was really hard because I was shy because of my accent. I was really scared I would say something incorrectly and people would make fun of me. So but Canadians are super nice and they try to understand you. They not judge you because of you are doing lots of mistakes. In terms of my work, I work remotely and I communicate with my manager, with my co-workers via email, via Slack. So first 2 months, I could spend hours just to write an email to them. I was worried if I make a lot of mistakes, so I rewrite it. It took a lot of time, and when I came to my first interview, I was not ready for doing this because I thought volunteer can speak Ukrainian, but my first interview and I came to volunteer organization and I realized that nobody of them speak Ukrainian. So, and I have no question in English. It was, oh my God.
It's a learning experience.
It's a learning experience, yeah. But when you live in English-speaking environment, the language learned much more quick.
I did want to ask you as well about what it's like to be a journalist in another country, knowing that your own country is still undergoing such a terrible tragedy and so many lives are being impacted. And I mean, the place where you grew up may have even had some damage done to it as a result of the military invasion. How difficult is it for you to just do your work and go day to day knowing what's happening at home back in Ukraine?
It is extremely hard for me. Sometimes when I read really scared news, I even can't concentrate on my work. I simply cannot edit. I make lots of mistakes in the editing. It's really hard, and my mom often sends me a video of rockets flying in the sky, of this explosion. But at the same time, my work, editing, writing, it's some kind of meditation for me.
Does it help you to have something to concentrate on, to be able to put your mind and your heart to, instead of thinking about the war all the time?
Yes, my work is my biggest hobby. and this is what I enjoy, what I love to do.
Are you at all optimistic that this war could be over soon, or do you see it going for quite a while longer yet? That may be a hard question for you to answer, but I am wondering what you think.
Of course, like hundreds, thousands Ukrainians, I hope the war will end soon, but I don't think that it will end in 1-2 months. And I'm really scared about people who are still in Ukraine, because the winter is coming and it is very cold. We have a big problem with electricity. People just we sit at the house without electricity, and a lot of my friends still in Ukraine, and I'm worried about that. Sometimes I even can't call them. It's really, really hard. I'm in a safe place, I'm in a safe country, but my mind, my thoughts are still there, still in Ukraine with my friends and family. I asked my family to come to Canada because I have a little brother. He's 10 years old, and I'm worried about his future. So, but my mom very scared to move into Canada. She doesn't speak English, and she supposed it is very hard to integrate into new society.
What helps you to calm down when you know what's happening back home, and you know that your family and your friends and your neighbors are affected by all this? So what keeps you going?
I believe that Ukraine will win in this war. I know that our people are very strong. We raised a big amount of money on different charity events to buy necessary clothes, necessary stuff for our Ukrainian armed force. So I know that we will win, and I learned to be grateful for very simple things. And once I came to Canada, I started to write journal. Yeah, and I before going to bed, I always write 5 things I'm grateful for today. It can be very simple things like working, like hanging out with my friends, or like delicious meal, or talking to my family, and something like that. But this is really think what makes me alive, what I very appreciate it. So I try to be positive, and also people around me in Canada, it's like newcomers, and this is Canadians. Everyone try to help me. They often invite me to different events so I can be involved and engage in Ukrainian community, talk to people. Yeah, our Ukrainian community are super strong.
Well, I want to wrap up this conversation, Yullia, by asking you, and this may be a far bigger question that you could answer right now, but I remember a few moments ago you were talking about how you wanted to make a fresh start in Canada.
Yeah.
And it sounded like you really wanted to turn the page and make a new life for yourself here. Can you see yourself staying long term in the country? And I mean, even as long as 5 to 10 years, should the war end within the next few months in Ukraine? Do you see yourself slowly becoming a Canadian now?
Yeah, I think so. I think I would stay here in Canada for years. I hope that I can build a successful career here. And even if the war ends and I come back to Ukraine, there are still no work for me. So it will be hard to find a job for me in Ukraine, I think.
Well, Yullia Kovalenko, it's been enlightening and occasionally very moving to talk to you, and we thank you for having the strength and the courage to share your story with us. And it's been a great pleasure to be able to spend some time with you. Thank you for giving us some time for Telile Community Television today.
Yeah, sure. Thank you for having me.
Yullia Kovalenko is part of the local journalism initiative sponsored by the Canadian Association of Community Television Users and Stations. She is based in Winnipeg. And there you have it. That wraps up this week's edition of Roundtable. Thank you for tuning in, and thank you once again to my interview guests this week, Nova Scotia's Minister for Mental Health and Addictions, Brian Comer, and Yullia Kovalenko, a member of U Multicultural Channel in Winnipeg as a result of the Cactus Local Journalism Initiative. Special thanks to Nova Scotia's Department of Health and Wellness for providing us with the footage from the community consultation held at the Port Hawkesbury Civic Centre on December the 2nd. If you have any comments or questions about what you've seen on Roundtable over the past hour, or you'd just like to make suggestions for a future edition of the show, feel free to contact me directly or contact Telile Community Television in Arichat. And be sure to follow Telile on social media. I'm Adam Cook. Thank you once again for joining me for this week's Roundtable. We'll be back next week with a brand new show. Bye for now.